What is up, everyone? It's Zai, and I'm about 3 months post-op. A little more than 3 months, but we're just gonna say 3. It's pretty much the same. And yeah, let me show you. Alright, so this is what it's looking like 3 months post-op. It's still pretty red, but honestly, so am I in general, so it just makes sense. I'm assuming these will fade fucking, what, a year, 2 years, 3 years? I do have this bump here. It's kind of like a knot at this point. It was where stitches were, and they just didn't dissolve very quickly. Overall, the main changes within 2 months and 3 months post-op is my muscle mass that is here, and that's not related to surgery. It's just it looks a little different because of that. I know you're like, oh my god, you're tiny. Bitch, I know I'm tiny, and I'll be tiny all I want. 3 months, I'm fine to work out. I don't have a problem with it. I do still try to avoid too much stretching overhead, but I am doing workouts that do require that, just not as heavily. A lot of people probably wonder about the numbness. This area is still numb. It was an area that was originally numb immediately after surgery and has always been numb since. But it's kind of like a circular area here. It's kind of hard to explain where it is, so I'll just draw it out, but it's kind of down here. But it's not completely numb. It's kind of like touching skin with the blanket over it right here. Like I can feel the pressure, but I don't feel the outside sensation like I do like here and here. I can feel my nipples. They just feel different than everything else. They're kind of just as sensitive as up here, which is just this is all normal. It's, you know, not affected. But it does feel like there's like kind of like there's a layer over it, and I'm touching it. It's feeling through that. Does that make sense? It doesn't bother me, actually. The numb areas don't bother me either. If I feel something leaning on me that leans from here to here, person, whatever, I can feel the empty spot of feeling. It's a little weird, but you get used to it. But yeah, I don't feel anything pulling or anything odd going on in there. I don't feel stretching when I lift my arms up. Unless I do it like really far, then I can feel it like there. So it's pretty comfortable overall, and I'm pretty surprised about that. Let me talk a little bit about what I've been doing for like scar care and just general care. Pretty much every night it gets massaged with bio oil. I don't know how beneficial bio oil is. It definitely keeps it moisturized for the most part. So the massaging has definitely helped with breaking down all that hard tissue that was here. There is still a little bit of hardness, but it's so much better. It's crazy. It feels like normal tissue now for the most part. So if you are planning to get top surgery or you already had it, I would very much recommend massaging it, preferably every day. I try to put sunblock on it every day. The incisions and my nipples, I forget a lot of the time. And you're like, why are you putting sunblock? You wear shirts. Well, the sun goes through most shirts, unless you're wearing an SPF shirt or something, then not very much sun gets through. But you should wear this because your scars get darker from the sun. And I do forget sometimes, and I'm just like, this, if I remember. But if I'm out for the day, I'm like, shit, I'm not gonna walk around like that. If I'm checking the mail, I'm like, okay. And I have started again using silicone tape. It just covers them. It's flat, and yeah, it's silicone. It's good to help with collagen alignment, and apparently for helping to flatten your scars so they heal flat. I don't know how much an effect it has on scars that are already kind of raised, like this one. This one is like a bump, kind of feels like a knot, and there's a little piece of it right here that's like a little bit raised. I started wearing that again because these healed up because they were kind of like open wounds, kind of, like in a way. So I started wearing this again like a week or two ago. So I'll be doing that regularly so we can kind of see if that changes the flatness of this part. I think that's about all I have to update you on. If you have any questions, drop them down below, feel free. And yeah, make sure you're following my Instagram, and if you like my videos, then sub. Thanks, y'all.